facet joint syndrome is describing generally inflammation around the facet joint, which is one of the structures of the spine. It's located in the neck, upper back, and lower back, the location of the facets. They exist in pairs, one on each side of the spine and at each level of the spine. They are essentially synovial joints, which are similar to the joints we have at the knuckles and the knees. They are in the back, the facets are in the back, while the discs are in the front. And they kind of work together to bring stability to the spine and help with the load and weight bearing of the spine as well. Well, facet joints are, one of the most overlooked when it comes to back pain. And it's about 15 to 45% of all back pain originates from these facet joints. So that is millions of people with back pain that stem from having inflamed facet joints. Well, usually facet joints will present as more localized pain versus radiating pain or traveling pain. So you can have localized pain at the neck or the lower back. Sometimes facet joints, when they get bad enough, they can radiate to other parts. So typically facet joints in the neck that are compromised will radiate into the upper back and the arm, while facet joints that are compromised in the lower back may cause a pain pattern down into the glutes and the high hamstring area. Facet joints can present as pain, of course, but they can also present as muscle spasms and just dull and achy pain in general. Facet joints can also be exacerbated with certain specific movements. So forward bends can also cause facet joint pain, as well as certain bending and twisting motions can also do that as well. The demographic that's most commonly affected would be, I would say, over 60% are adults over the age of 65 that have some sort of arthritic change in their neck, and over 90% of adults over the age of 65 have some sort of degenerative or arthritic changes in their lower back and are affected as well. Now, the facet joints and the discs work together. So when the facet joint is compromised, the discs also may tend to get involved, causing, a dual, and both of those to mostly be feeding off of each other and causing your pain. So chiropractically, we will address both the disc and the facet joint when working with a patient who presents with some of these symptoms. As mentioned before, it can be, if it's acute, it can be more sharp shooting. If it's more chronic-y, it can tend to present more dull and achy, sometimes paired or coupled with muscle spasms. In chiropractic, we're able to feel for tenderness around the facet joint. So just a little bit of palpation or pushing into the spot. Sometimes we'll observe for any inflammation at the area where the pain is. And then other tests that can be done diagnostically could be x-rays that could look at the joint spacing and if there's any inflammation around that facet joint. There are also a slew of orthopedic examinations that can be done during the treatment process and the consultation process. And that's probably where I would say would be the most expert way to diagnose facet syndrome are through the imaging, the orthopedic tests, and of course, touch and feel. That's a really complicated question, because once a facet joint has, let's say, degenerated or deteriorated, we cannot regrow the bones, but we can manage it pretty well. Of course, if you're catching your facet syndrome a little bit on the earlier end of things, we can start to stop things in its tracks and start to reverse the process through good treatment. More in a conventional medicine setting, you're going to get the injection therapy option or facet joint injections. And the goal for this is to reduce inflammation at the joints in order for us to be able to fully utilize our bodies to be able to do the physical therapy. Physical therapy is very important in the recovery process to help to strengthen the muscles around the facet joint while the pain is reduced. Other options for managing facet joint syndrome is non-steroidal anti-inflammatories. So your NSAIDs and any sort of muscle relaxer that would be paired would help with managing your facet joint pain. Now, more in a holistic sense, we like to treat facet joint syndrome with sometimes heat or cold therapy, depending on whether a condition is chronic or acute. So if your facet joint syndrome is very new and acute and there's inflammation, we may start off with some cold or cryotherapy, followed by heat therapy and then a contrast therapy. At our San Francisco clinic, we do utilize both cold and hot therapy, along with another set of therapies such as chiropractic and acupuncture. One big thing to understand when it comes to facet joint pain is that it can sometimes pop up for numerous reasons. I mean, we may sometimes go to pick up something heavy off the ground, or sometimes it's random. We just kind of wake up with it from maybe sleeping incorrectly. We've seen these types of conditions pop up for many different reasons. But regardless of the reason, we treat all types of facet joint syndrome at our San Francisco clinic here at TrueSpine. One thing that has worked for our patients is getting them into a supportive brace. Wearing a supportive brace in between flare-ups can definitely help to reduce the discomfort that comes with facet syndrome, and pairing that supportive brace with treatment therapy at our clinic can help. So chiropractic treatment can help to take pressure off the facet joint syndrome through a technique called spinal manipulation therapy or adjustments. Adjustments are quick forces into the joint to help to decompress the joint and reduce inflammation. And we do offer chiropractic therapy here at our San Francisco clinic. And another beneficial therapy is acupuncture. Acupuncture could be very helpful in helping to ease the tension or pinching of the nerves to help relax the muscles around the nerve, especially if your facet syndrome presents with any radiating or traveling pain. Other than that, we love to pair our chiropractic and acupuncture care with exercises or rehab exercises to ensure that once we get rid of your facet syndrome, that it stays away and it doesn't come back. So strengthening the muscles around the facet joint can be very, very helpful. The short answer is no. Facet joints are deep and massage therapy is more superficial. Can it help in aiding with the recovery process? Yes. Once the acute phase has been complete, then massage therapy can aid in helping you recover from facet joint syndrome. Well, it really depends on how long you've had your pain and multitude of other factors. But typically we're able to resolve facet joint syndrome at our San Francisco clinic in about 4 to 6 weeks. Well, the body is self-healing, but sometimes it needs a push in the right direction. And we believe our chiropractic care paired with acupuncture and other therapies can help you on your way. The top 3 exercises for facet joint syndrome are planks, child's pose, and cat-cow stretch. We typically like to recommend patients that are suffering from facet joint syndrome to sleep on their side with a pillow between their knees and trying to keep your body in neutral positioning if possible. The proper pillow and mattress are also recommended. The best medications for facet joint syndrome are NSAIDs, acetaminophen, and a type of muscle relaxer. However, we highly recommend to seek out professional help before attempting to try one of these medications for your pain.